living with chronic lung disease, you may notice your lungs are not the only thing struggling. Many of us carry stress, guilt, or shame, sometimes around smoking or vaping, or even just the way our lungs behave. You might cough more than you'd like, or feel breathless in situations you once managed easily, or notice anxiety creeping in with every deep breath. These feelings are real, human, and important to acknowledge. Hey there, welcome back to my channel. I'm Dr. Devi Sundar, an integrative mind-body consultant, and in my channel, I talk about lung and mental health. I recently watched a TED Talk by ZZ Frank called Are You Human? He asks these wonderfully simple, quirky questions like do you wish life had an undo button? Or do you sometimes feel like an imposter? At first, it feels lighthearted, but then you realize he's touching on something deeply human. Those moments of regret, guilt, or shame that connects us all. And I thought many people living with chronic lung disease feel that way too. Because when your body changes, when your breath becomes effortful, when you're being judged for smoking or coughing, that imposter feeling can whisper, you don't deserve hell. Now imagine carrying those feelings while you're struggling to breathe. The cough, the breathlessness, the fatigue, visible reminders of something invisible inside. A recent nationwide UK service development survey by my organization, Tele-Therapies, found that only 31% of UK adults recognize the connection between the mental health and the chronic lung conditions like COPD, asthma, or long COVID. That means nearly 7 in 10 people are unaware of this emotional dimension. This lack of awareness creates an invisible burden. People live with breathlessness, coughing, chest tightness, while also carrying that burden of anxiety, guilt, and shame, yet often without realizing how deeply the mind and lungs are connected. And this isn't just a national issue. It's a part of a global wake-up call. According to the World Health Organization and European Respiratory Society's 2025 joint report states that more than 80 million people in Europe live with chronic respiratory disease. Yet these conditions remain unrecognized, underfunded, and poorly integrated with mental health care. The message is clear. There is a greater calling that this is a time for prevention and whole person care. Why this matters and why am I talking this now? Because for someone living with chronic lung disease, their behaviors and emotions are often intertwined. For example, people struggling with chronic respiratory disease will struggle with the self blame and guilt for having smoked in the past or vaped in the past, even after quitting. And that shame about coughing or feeling breathless in the public and how they've been perceived differently in the public. And that anxiety that actually makes breathless more worse. That fear of judgment, believing that others see them as solely responsible for their illness. And the feeling of undeserving of care, thinking, I did it to myself, so I shouldn't complain. That's the imposter voice in illness, the one that whispers, you don't deserve help. But the truth is, every person who breathes deserves compassion, not judgment. Because our survey shows that so many people don't even realize the link between the mind and lung health. Many internalize their shame, thinking their cough, breathlessness, or smoking habit is purely physical, rather than a part of a larger human experience. For instance, our survey data shows that young adults between the age groups of 18 to 24, and men particularly, with only 28% being aware of the link between mind and lung health. That means many working age people are silently going through the struggle without understanding why. This is why awareness matters. Understanding the mind lung connection, even outside the clinic walls, helps break the cycle of anxiety and breathlessness. In the UK, NHS does an incredible work, but it often functions as a disease service, not as a preventive care system. That means mental health and breath-related issues are often treated separately, leaving many people to find their own path to healing. That's why I wrote my book, Breath Beyond Illness, to give patients, carers, and healthcare professionals those tools of awareness and self-care. Because caring for your mind is caring for your lung. Every breath is an opportunity to reconnect with your body, emotions, and health, even when preventive care isn't widely available. Now, let's pause for a moment for a gentle breathing check in. Sit comfortably, place one hand on your chest and one on your belly. Inhale gently through your nose for 4 counts, letting that guilt or tension lift. Hold for 1 or 2 counts. Now exhale slowly through your mouth for 6 counts. releasing your frustration or shame. Repeat for 2 or 3 minutes, simply noticing the sensations in your body. You don't need to fix anything, just notice. This helps your nervous system to relax, calms your anxiety, and reconnects your mind and lungs. Now, after a few breaths, ask yourself, did any feelings arise? Perhaps regret after smoking, shame about coughing in a public place, or that imposter feeling that others see you differently. That's okay. That's human. Recognizing these emotions is an act of courage. So if you're living with lung condition or ever felt guilt, shame, or the urge to hide, please know you're not alone and you're not imagining it. The data show this emotional side of lung disease is widespread, yet under-recognized. We now have an opportunity to treat lung and mind together, to address smoking or vaping not only as lung risk, but as emotional coping habits, to breathe, feel, notice, and reach out for integrated support. Beyond our individual journey, there is a global mandate. The WHO and ERS statement calls for integrated, preventive, relational care for lung health, mind and body together, not separate. You, me, our communities, and our health system must respond. That's why awareness, breathwork, and compassion matters. Because every breath we take can be a step towards healing for our lungs and for our humanity. Thanks for taking this time to pause and breathe with me. If this message resonated with you, please share it with someone you know might be struggling silently with breathlessness, shame, or fear, not realizing that their mind and lungs are connected. Remember, you're not your diagnosis. You're human, capable of healing, of self compassion, of change with every mindful breath. Together, we can shift the way chronic lung disease is seen, from a condition to be endured to an experience that can be understood, supported, and lived with dignity. If you'd like to learn more about my integrated Breathe Better program, visit www.tele-therapies.org or explore my book, Breath Beyond Illness, for tools that unite mind, body, and breath. Until my next video, keep breathing with kindness, stay curious, and stay healthy. Signing off, Devi Sundar.